Hello everyone, welcome back to the channel. Today let's talk about a serious and life-threatening condition, GDV, also known as bloat, which is quite common in large dog breeds and deep-chested breeds. GDV stands for Gastric Dilatation and Volvulus. In simple words, the dog's stomach fills up with gas and then twists off itself. And because of the twist, both the entry and exit of the stomach gets blocked, trapping gas and food inside. This causes extreme swelling of the abdomen and affects blood circulation, leading to a medical emergency. If you see these kind of signs, immediately rush to your vet, because every minute here counts the life and death situation. At the clinic, we generally confirm GDV using an X-ray. The GDV shows a characteristic double bubble appearance or Popeye arm shape of the stomach. Here we go with immediate decompression to relieve the gas and emergency surgery to untwist and reposition the stomach. Since the gas blocking is way too high, we prick the abdomen and typically the stomach to relieve the gas externally. Then we take the pet to the OT. We will pass a stomach tube so that the gas is removed and all the contents will be washed. This is something called as gastric lavage. And at times we may not be able to pass the stomach tube because of the higher level of twisting. So immediately we have to choose for gastrotomy, that is opening of the stomach, remove all the contents, and we have to attach this stomach to a wall of the abdomen so that it will not turn again. During this phase, one of the organ called as spleen, which gets trapped very badly because the vessel which is supplying to the stomach continues and also supplies to the spleen. During this condition, it gets twisted and the spleen will no more get any amount of blood supply. So we have to go for splenectomy too. To counteract this metabolic acidosis, we go with a lot of Ringer's Actate, and we can also go with bicarbonate infusion. Meanwhile, we have to go with a good amount of pantoprazole, which is a proton pump inhibitor. We do give a dose of ondansetron to move the gas which has been trapped if possible. During this condition, there will be a lot of tachycardia in the pet. So we do give buterphenol to calm the pet, and also if the tachycardia is way too high, we have to go for IV lidocaine. This condition is very critical. Even after decompressing and after the surgery, the chances of recovery is way too low. Because of all these oxidative changes that happened in the body, we have to continuously monitor by keep on giving crystalloids, plasma volume expanders, continuous monitoring of ECG, blood pressure, monitoring oxygen concentrations, because there will be high chance of getting hypokalemia, hypocalcemia, hypoglycemia. There can be severe tachycardia. Once the animal passes 12 hours of critical period, we keep on taking x-rays, and after 36 to 48 hours, we will start slowly probiotics, antacid syrups, and we'll introduce gastrointestinal food. If after 72 hours, if there is no retching, no vomition, or the animal is comfortable, and in between we will be checking a blood report that gives us a confidence that there is no changes in the abdominal organs. So always GDV can be a very critical situation. As I said, every minute here counts. If you delay beyond 3 to 4 hours, it can be a very life and death situation for your pet. Hope I have briefed a very good information on GDV. Thank you. Subscribe for more.